Hi, Dr. Shire.
And Dr. Scott.
And we're going to talk to you a little bit about peripheral neuropathy, what it is. Peripheral neuropathy can strike really anyone. It is known for associated with those who have diabetes, but really many of our patients who come in, they don't have diabetes, but they do have this neuropathy. And what neuropathy is basically damage of the small peripheral nerves, peripheral meaning periphery, around the periphery or the outside. So when your peripheral nerves are involved, it's going to hit the outside of the body, like your hands or your feet. And basically what starts to happen is the small nerves that are in the hands and the feet, and you can get it either in the hands or the feet or sometimes both. What happens is those small nerves start to degenerate and eventually die off. And again, it can happen for many reasons, but the way to stop neuropathy is to, one, create an environment where nerves will grow healthy again. And then, of course, we want to get as much blood and oxygen to the area so those nerves can heal. And we do have a chart here. We're going to hold it up. Hopefully you'll be able to see it. Maybe. And you'll notice that the nerve on top is nice and healthy. The one in the middle is not so healthy, and the one at the bottom is quite sick. And the way it works is this. Most people, when they're coming to see us, they're not going to come see us if the nerve is healthy. They're going to typically come in when the nerve starts to get sick, which is great news because those are the people we can typically help. If the nerve becomes dead, that's going to be a challenge, and we're probably not going to have much success with that. But fortunately, most of the folks who come in complaining of neuropathy have some sick nerves, not some dead nerves. Doc, you want to speak about that?
It's very true. And here's the thing. Your perception of how sick or how dead your nerves may be may not be accurate, because you can have numbness where you can't feel your foot at all, but the nerves aren't actually dead. They're just not sending the right message to the brain. And so we do have patients at all levels of degenerative states. You know, we've had them to where they're using walkers, even wheelchairs, and they still can get some relief. They can still have some tissues that can heal up. Now, obviously, the earlier the better. So if we can catch a condition in its early stages, then more and more of those tissues are going to be healable, you know, to the point where they can still heal themselves. But that's really the point I wanted to make.
Okay, great. All right, in our next video, we're going to talk about laser therapy and how that applies to neuropathy. Okay, see you on the next video.
See you then.